Good evening, ladies. I hope you are all having a fantastic day. We are here for Wellness Wednesday. Welcome. All right, welcome. And just had to make sure my volume was turned down on my phone because I always forget to turn it down. And I think, we started this meeting without too much of a technical hitch. So the past few weeks, we've had several technical issues, so we're going to count that as a big win. All right. While everybody is jumping on, there may be a few new ladies on tonight, so welcome. I am going to go ahead and go through my disclaimer while we wait for any stragglers to make it on our live feed tonight. So anything that I say tonight is just health information and is not specific health advice. Do not start taking or stop taking or change the way you take any of your medications. And if you feel like you need to do that, please talk to your prescribing practitioners so that they can help you make the appropriate adjustments. And finally, attending Wellness Wednesday does not establish a doctor-patient relationship. Okay, there you have it. Every time I do a live event, got to do that. Okay, so, and in fact, the topic tonight is in fact medications. All right, super broad topic. It is, there is so much I could focus on in discussing medications. Because of this group and why most of you are here, and that is to get help with your thyroid issues, to get help with the symptoms that you're having with, like major fatigue, sometimes major, sometimes just fatigue, tiredness, sometimes well, a lot of you are looking for why it's so difficult to lose weight and why it's so difficult to sleep well, and why the brain fog, why the depression, anxiety, all these types of symptoms. All right, digestive woes, pain, joint pains, muscle pains, fibromyalgia. Certainly a lot of symptoms that there are a lot of medications for. Symptoms that doctors, well, simply put, we are trained to either find the disease or find identify the symptom that we may be able to treat with medications or with surgery. And so what I intend to kind of focus on tonight is some general considerations regarding prescription medications, and then after I talk about some of those things, I will discuss specifically thyroid replacement prescription medications, and then I'll field your questions if they are not too specific in nature, but more general. And because as I'm just kind of thinking about, the topic tonight, there may be a few details here and there that might be really important to bring up that you might ask me about. So, all right, some general considerations. So when talking about how doctors, approach disease or symptoms, if, or even lab results, if there is a particular lab marker that shows that there is disease, something that is outside of the normal range, and if it is something that that doctors can do something about, then typically what we can do is prescribe a particular medication. However, I think most of the time you will find, as you have been to the doctor multiple times, some, many times, many of you, is that you will tell them you have a specific symptom, and that symptom is somehow a disease. All right. So what I'm talking about is like fibromyalgia, for example, indigestion, right? Headaches. Somehow, migraine headaches is some sort of a disease, right? So there's a lot of medications for that. I mean, there's several different classes of medications to treat migraine headaches. There's several different classes of medications to treat indigestion and reflux and heartburn. There's several classes of medications to treat pain, right? There's so many different things that the doctors can prescribe for these types of issues. And then ironically enough, when there's a symptom and it doesn't even have any lab markers to go along with it, like migraine headaches, like depression, anxiety, there's still a medication for that. Lots of them, lots of medications for, different medications, different classes, multiple classes of prescription drugs for depression, for anxiety, for bipolar disorder, for, whatever kind of, mental illness. There are going to be some medications for that. And so, so let's talk about, medications and some general considerations. Okay. So when it comes to taking care or relieving these symptoms, medications are 90+% physiologically active, meaning they are so potent that they will force your body or the target tissues, meaning what types of tissues these medications are supposed to be absorbed into and to affect. 90+% effective, right? Meaning too that because they're so powerful, they force those tissues to do what your body can't make those tissues do on its own because it doesn't want to. And that's interesting when we stop to think about it. Well, yeah, it feels so much better to be out of pain. Those pain medicines, it feels so much better when you don't have those, those chronic pains, especially, or, if you've been in an accident or had surgery. Oh, it's so much better when that pain goes away. That's pretty acute sometimes with those, those types of things. And so it's, medicine might have its place, and it does. I'm going to say it does. I've had, surgeries before, and and I was given pain medication. Although I'll tell you, hated them, couldn't stand taking the pain medicine. It made me so sick, made me so dizzy. Couldn't handle that part. So I have a pretty high threshold for pain, or pretty high tolerance. So I just got through it. It was a lot better than being jacked up out of my mind on those on those pills. So, it's when medicines act and they force the tissues to do what they, these tissues aren't really wanting to do. These medications are utilizing resources So nutrients that your body needs for something else. All right. And so when that happens, um, those resources become depleted. And at first it doesn't really make much of a difference, but the longer you're on some of these types of, things, the more resources are used up, the more these nutrients are used up and not available for that normal tissue functioning. And so what happens? Well, you have side effects. Something happens in response. They call it an adverse effect. Now, I'm going to tell you something that might blow your mind, but that's my job. Okay. So, pharmaceuticals, pharmaceutical companies usually do not approve the formulation of a medication unless there are some side effects. And I won't necessarily be able to say how many, but there have to be some side effects. So one of my good friends, he's actually was a wildly genius, wild genius of a biochemist, and I say was because unfortunately he passed a couple of years ago, and as in our discussions together, he worked for one of the pharmaceutical giants, and I'm not going to say which, but he left because of what he felt were was the unethical practice of developing drugs that were not approved. Of course, they had to be safe, but they weren't approved for distribution unless they had at least X number of side effects, which was shocking to me. And I quizzed him about it. I was skeptical. And what he had to say convinced me. I mean, he obviously was speaking from firsthand experience. And so I guess I had to believe his firsthand account. He resigned. He took his his formulations with him. At that time, I actually had his help to develop a supplement that I no longer produce. It's been years ago. And it was the same formulation or a similar formulation to metformin. So it just didn't have the side effects. And his formulation was tabled. And of course, another formulation was approved instead. So I'm going to let you draw your own conclusions about the impact, the impact of that. If medications are supposed to have side effects, what conclusions can you draw? Okay, so there's some food for thought. Now, the other thing to consider, about medications is that they're masking symptoms that actually go completely against really what your body intends for you to, intends to do for you. And remember, as I gave the master class, we talked a lot about the subconscious mind and what, what's really in control, right? Your body knows what's going on. Your subconscious mind knows exactly what's going on, and what's happening, but it's just It's directing traffic and it's doing the best it can with the resources it has. So, consider medications, for example, that lower stomach acid, for instance. Okay, so if you have a problem with reflux or with indigestion, and they give you an acid blocker or a PPI inhibitor, right? Proton pump inhibitor. Well, what are those supposed to do? Those are supposed to decrease your stomach acid. But what's really going on is when you have reflux, esophageal reflux, GERD, gastroesophageal reflux disease. And again, they call it a disease. It's a symptom. It's a symptom, but they have to say it's a disease and give it a name so that it, is, I don't know, somehow acceptable to the insurance companies, and then they can, justify the use of certain medications, and then the pharmaceuticals get more doctors to prescribe them and they make more money, and yeah, it's great. It's a great racket. So yeah, you heard it here first, folks, right? So these drugs will decrease the stomach acid that is already very much decreased. So the problem is generally that you don't make enough stomach acid when you have indigestion and reflux and things like this. What reflux is undigested food that's mixing with the stomach juices and the unfortunately the enzymes that aren't fully activated because they need the acidity level in your stomach to be so low to activate the enzyme so that the protein actually digests properly and fully. Instead, you're getting undigested, or I should say, incompletely digested food refluxing into your esophagus. Sometimes it goes all the way up. It's nasty, right? If it were truly stomach acid, ladies, it would burn a hole in your esophagus. It would burn a hole wherever it contacted. That's how acidic actual stomach acid is. And there's a protective lining, a mucus lining that protects the stomach from that acid so that it doesn't break down and you don't get holes in your stomach. Unless when you do, it's slow, it's, ulcers form because incompletely digested food is still acidic. And it is going to eventually, it can cause ulcers, right? Which are erosions, and it's because of the acidity, but it's not as acidic as actual stomach acid is. I'm just going back to chemistry. This is, if you ever worked with hydrochloric acid in a lab, it'll burn a hole in a lot of things. Burn a hole in a plastic table, burn a hole in, even some metals. Okay, so think about this. They're giving you medicine to lower the already low stomach acid. And what happens is it basically stops a lot of the fluid buildup in your stomach from your stomach cells. And then your food really can't reflux. It'll kind of sit, and then it'll eventually, be passed on into the intestines, into the duodenum, and then that undigested protein ends up causing leaky gut and, other symptoms. So this is like I said, some of what kind of a general consideration. Medications are often targeting symptoms that are annoyances. They're frustrating. They're painful. But it's your body's way of telling you that something's wrong and that you need to do something about it. But Instead, there's a Band-Aid for it. Okay. All right. Generally, medications, okay, so there's, as you know, there are different delivery systems, right? You can take a pill. You can take a medicine by IV. You can take a medicine, injected, say into a joint. You can take a medicine that dissolves under your tongue. There are, there's lots of different delivery systems. Topicals, right? There are creams and things. There are topicals. There's suppositories, and you know where to stick them. So, lots of different delivery systems for these medications, and so some of them, they're all kind of metabolized differently. Most of the medications that you take orally have to pass through the liver's detoxification pathways. Okay. And so they have to be changed. They have to be altered to more active metabolites. So not only do most medications, they cause side effects. They force your tissues to do what your body really doesn't want it to do. So, but it also stresses your liver. And from there, if it's not processed as much by the liver, it's going to be processed in the kidneys. So whichever one, you're going to stress those different organs. And so that has consequences too. And I, like I said in the beginning, I understand. I do believe certain medications have their place when they're used appropriately, when they're used judiciously, and for the right reasons, and so forth. There's not as many problems, except that they will have side effects, right? And so this is kind of what I wanted you to consider about these. When they are being used properly, you can still count on them to deplete your resources, to stress your liver or kidneys, to have some sort of side effect. All right, contrast medications, and I'm not going to talk too much about the herbal side, the natural side, because that's a whole different topic. But those types of treatments can also be Band-Aids. They can also have certain side effects, but they are not as physiologically active. They are, herbs in general are, where a medication may be derived from a natural substance, like white willow bark, aspirin, right? Or, berberine, which they derive metformin from. These are not quite so metabolically active. They do take longer to take effect, but they're not depleting your body as quickly of the resources that the medications are. And so they are slower to act sometimes, or most of the time, but they are they're not as quick at depleting your resources. So just understanding the difference, I think, is important. Once again, medications overall, I just like to say that they're bullies because of what they're doing in contrast with more natural treatments. Okay, so again, don't think that I'm completely against them, but I really believe that medications are to be used very judiciously, so much less than they are. And, we just have to really consider when they're appropriate. Okay, so let's talk about thyroid replacement medications briefly. So there are a lot of different kinds, but let's focus on synthetic versus natural. So synthetic are based on our own human hormones, thyroid hormones, but they're just enough different that they're not bioidentical. And for this reason, the synthetics, and I'm talking about levothyroxine as the generic, and there are multiple brand names, Synthroid, Levoxel, Euthroid. I mean, there are lots of different brand names. Tyrosine, and then like T3, liothyronine is the generic, and Cytomel, or I'm just not thinking of them right now, but they are just different enough that labs won't measure the levels of these synthetic hormones. And also for this reason, because they're just enough different, 80% of the time, they are not super effective. Okay, 80% are not effective. Now there are natural forms. So these forms are derived from animal sources like bovine, cow, pig or porcine, ovine, lamb, and they are more like our own tissue, our own thyroid hormones. So these are some options. You will hear and see in the information that's available on Dr. Google that it is more difficult to get a specific dose of thyroid replacement in these natural forms. I used to be bothered by that. I would prescribe Armour thyroid, I would prescribe NP thyroid, WP thyroid, thinking that they were more specific with their dosing, more accurate in what they contained. And then we started hearing, there were recalls. Over the years, we've heard recalls for all of them. Like, okay, why? Because they could not verify the actual, active compounds in these extractions, right? These natural extractions of T4 and T3, which that's what they are. They're extractions and they're combinations. And so you just look for another one, go find the next one that's available. No big deal. Medicines in general are made into capsules or tablets or injections, like I said, and they always have to have some sort of preservative, some sort of glue, some sort of filler to make the little tablets stick together, hold together. And so, and it's not just with thyroid, but it's with most other most other medications too that are especially in tablet and capsule form. They're all going to have fillers that are either wheat-based or corn-based, maybe even potato starch-based, things like this, okay? And so, we talk a lot about why we shouldn't have those substances because they can hang around in our bodies forever. No, not forever, but 3 months for wheat and gluten, even up to 12 months, I've learned. 12 months. Gluten, the effects of gluten can stay in your system up to 12 months. So these pills, and that may be the only thing you're taking is those little pills, and you're going to stay sensitized. That's going to trigger the autoimmunity if you have it, the Hashimoto's. So any little bit, right, will keep that little, that fire burning, even a little, and can make it difficult to, to get real, real, um, I want to, the word is more consistent relief. Okay, so back to the thyroid pills. So I stopped kind of caring about how accurate the dosing is with these thyroid, you know, it's it in fact, these natural desiccated thyroid forms are much better tolerated and do seem to be quite effective. And so a lot of times we'll just be okay with a little bit variable dosing from day to day, because um, that's honestly the best we're going to get when your own thyroid is inconsistently producing thyroid anyway. So it's no different. When you have Hashimoto's, especially, the number one cause, and I talk a lot about this in the masterclass that's coming up. If your own body is not even producing this thyroid hormone consistently, how much different is it going to be to add some natural desiccated thyroid that may or may not be even, I mean, it may be even more consistent than what your own body's trying to do or able to do. So, like I said, I had to stop kind of caring because there's really nothing you can do about it. And when most people don't respond very well to the synthetic hormones, then I'm sorry, but the next best thing is to rely on the natural desiccated thyroid formulations and we have several. We have some really good ones, and a lot of them are non-prescription. So you don't have to go through a pharmacist to get these. And for many, and I do bring this out in the master class, for many, just changing the thyroid hormone isn't what's going to do it for you. It's not what's going to solve your problems. Most often, and you find out with comprehensive testing that there are many other dysfunctions, areas of dysfunction, many other imbalances, triggers. Some of you that may be on tonight have gone through that evaluation with me. Some of you are maybe waiting to go through it. You're going to find that there is a lot more than just tweaking your thyroid pill. Okay? So remember, at best, medications bandage the symptoms. When it comes to hormone replacements, yeah, sometimes they're very important and they're necessary. They can still have ill effects. One of the main side effects of levothyroxine is weight gain. I mean, come on. That is not what you hoped for if that's why you were given that medication, to help you solve that problem. And so many have told me that they were prescribed it and they started taking it, noticed weight gain, and so they stopped taking it. Okay. Finally, the last thing I'm going to kind of wrap up with is, and it kind of ties back to the disclaimer. When I tell you seriously to don't start or stop taking your medication just because you feel like you should necessarily, if you've been on something for a while, it really may be better if you wean off a particular medication than just stopping taking it cold turkey. There are many drugs like that. There are heart medications. There are antidepressants, so mood stabilizing medications that you just, that are also maybe given for medications given to prevent headaches that are anti-seizure medications. So these types of things you don't want to just stop taking. You need to be weaned off appropriately. Okay. It can be very dangerous and even life-threatening if you just stop something that you're taking cold turkey, because remember, they're so physiologically active. They've been forcing your body to do, and those tissues to do what they couldn't do for themselves. And now all of a sudden you yank away that bully and those tissues are like they can't function. Okay. So that can be bad. So I hope this has been instructive. I understand that there are several questions, so I'm going to check those out, and we're going to get to those right now. All right. Jeez, I can get up to my. Okay. So is Armour thyroid wise? For the most part, again, it's going to be a little better than the synthetic in most cases. But if you're reacting poorly to it, maybe that's not the best thing to do. Maybe you should, until you can get a solid, comprehensive diagnosis, which for you new ladies, I'm going to talk about that in the masterclass extensively. So you don't want to miss it if this is truly one of your concerns. It may be better than nothing, okay? But always remember, it's made with the fillers that it's made with and the glues, and you know you may be reacting to it adversely. Are you able to get your patients off most medications? So I'm glad that this question is asked. It really is an individual thing, but most of the time, yes. Thinking back to a recent, success story, we'll say, with her name's Cindy. She was on, I don't know, 11 different medications when she began. She's done so well after, going through her process, her individualized care plan, and she is off 9 of them. So gentleman that I've treated for diabetes and neuropathy was on 4 different medications for diabetes, including insulin, medications for blood pressure, neuropathy medication, a couple others, off all of them, off every single one of them. Okay. And his diabetes reversed, and his neuropathy is no longer, and he can stand around all day on the cement floor at work and is doing great. Lost 60, 70 pounds. Okay. How do you get patients off their medications? Well, by addressing the root causes. All right. By taking you through the blueprint that I teach you about to the nth degree in the masterclass, because following that blueprint works to, by treating the root causes and triggers for autoimmunity so that your body can heal. And then you find that, say as your blood pressure decreases, you don't need the blood pressure medication any longer. As your blood sugars decrease, you don't need the blood sugar lowering medications any longer. As the headaches resolve, you don't need to take your headache medication any longer. I mean, antidepressants, the list goes on. As you find you're happier and less anxious, and you just don't, you can start weaning off those antidepressant medications. Yeah, that's how. It's a process. It's a process that is individualized to you. Where can you get Biothroid? From Dr. Redd, if you're his patient. um, Only certain practitioners around the country and in clinics around the world are able to have access to Biothroid. You have to go through a training, and and as I have, and that way I'm able to get that, and it's great. But the unless you go, there are some other raw desiccated thyroid sources out there. I don't really know how good they are. I have had people try them. The jury is still out for sure, because I have heard that they are effective for some and not effective for others, and so it's hard to say. Are there any thyroid medicines that wouldn't aggravate restless leg, periodic limb disorder? Well, it's really even hard to say if it's your thyroid medication. It may very well be exacerbating it, probably because if it is if it's a synthetic that's doing that, then it does have side effects. A natural desiccated form might be better. All right. Is it, Hazel asks if it's harmful to go off statins cold turkey. That one, it is not harmful to go off statins cold turkey. They are causing enough damage on their own that it's far better for you to make your own decision. Let your doctor know that you don't want to take it. Go back and listen to the Wellness Wednesday that I did on cholesterol, please, before you decide that. That is a very helpful instruction on the effects of statins, why cholesterol is so important. So at the top of the group page, where it has the little magnifying glass, search for cholesterol and watch that Wellness Wednesday. All right. Okay. Are there any other questions? And I hope, like I said, I hope, ladies, that this has been instructive for you. This is a topic that runs deep, and it's, I became a doctor hoping that I would be able to, prescribe medications, refer for surgery, so that people could get well. And what I found out instead is that medications generally just keep you sick, but that's okay. There's another medication for that side effect. Okay, you get my point. So there are so many different ways to go about this, but the main thing is we've got to see what's really going on under the surface. Why are you having those symptoms? Let's help you get to the root causes. So for those of you, again, who are new, and this is kind of a smack you in the face kind of a topic, I'll discuss a lot more about getting to the root causes in the masterclass, and you'll definitely want to sign up for that as soon as the dates are posted and as soon as that gets announced. Okay. All right, ladies. As always, such a pleasure. We'll leave it there tonight. We'll see you again next. Actually, there will not be Wellness Wednesday next week, because I will be on vacation with my family, and we will be largely out of commission for Wellness Wednesday. So I will miss you, but we will be back the following week. And next week, if you're new, go back and search out some of the topics at the top of the group page, like cholesterol, like parasites, depression, Hashimoto's. Search some of these terms, as I've likely done a Wellness Wednesday, and watch that instead. And please take care. Remember to have hope. There are answers, and you still have the power to heal. Good night, everyone.